Let's continue with our COVID-19 coverage now. Doctors have traced an aggressive rampage through the body from the brain to the toes when investigating how the coronavirus causes seriously ill patients to die. I want to get straight to our interview with Professor Shabir Mahdi, who is leading South Africa's first COVID-19 vaccine trial. He is a professor of vaccinology at Wits University, and he joins us now via our video line. Professor, good morning. Thanks so much for your time on the AM report. Just doing some research on, those of us who have lost people close to us from COVID-19, and we're told all kinds of things about other organs, not just the lungs that are affected by COVID-19, but how the virus, or perhaps the body's response to the virus, also injures many other organs.
So good morning to you. And I think what you're saying is completely correct. So what COVID-19 does is it causes what we call multi-organ dysfunction. And the manner in which it does that is that there appears to be clotting in the blood vessels, which consequently results in less amount of oxygen, as an example, being delivered to the tissue. So whether it be the brain, the kidney, the lungs, the liver, or even the heart, effectively what's happening is that there's sort of obstruction in the blood vessels. It is what we call thrombus that's developed in these blood vessels, and what it means the clotting of the blood. And pieces of that clot then actually disperses further down into the microvasculature, which is really what is required for adequate amount of blood to be delivered to the end organ for the cells to function. So that deprivation of oxygen to the cells is obviously what's causing the damage. In addition to that, what we also have is when the body mounts an immune response to the virus, when the immune response is sort of dysregulated and in a sense overzealous, that immune response, rather than protecting the individual from the virus, is inadvertently resulting in sort of collateral damage of the surrounding tissue. So those two mechanisms is what's really leading to sort of multi-organ dysfunction and sort of a diversity in terms of the clinical manifestations that we experience in people with COVID-19.
And I suppose the big question for many people, as I say, who have had family and close friends, loved ones affected by COVID-19, some of them dying of the virus. The question is, why does it affect some people worse than others? And I know we've always talked about comorbidities, but it's not that simple, is it, Professor?
Certainly not. So I think comorbidity is an important component of it, and many of these comorbidities ends up upregulating what is known as the ACE2 receptor, which is really an important part of the body, which the virus depends on to be able to sort of gain entry into the cells and start causing damage. But in addition to that, there is some evidence to indicate there might be some sort of a genetic predisposition as well. There's certain individuals, as an example, people with blood group type A, they might be more susceptible to developing severe COVID illness. So there's a multiplicity of factors. I think the reality is we're learning as each day goes by in terms of getting a better understanding of the virus itself, which individuals are at high risk, as well as what other factors might be increasing the susceptibility of an individual to become severely infected. So there's multiple things at play.
I mean, Professor, you said it just now. We are still learning, and people like yourself, we're still learning about how the virus affects people, how it affects different people. Is that something that makes the job of medical practitioners all the more difficult, that we are still relying on so much research when deciding the best response and the best treatment for a patient?
Without question, and that's the reason why often we get it wrong, and in parts, in fact, we did get it wrong. As an example, when at one stage we said people shouldn't wear a non-surgical mask, and now we're saying it's obligatory to wear a non-surgical mask, and it just really manifests in terms of how little this is a new virus, so there's going to be a learning curve, and the learning curve with COVID-19 is an extremely steep one. So yes, we're refining our policies and our recommendations almost on a daily basis. As new evidence comes to light, it's important that we critically appraise that new evidence and make the best decision based on the current evidence rather than any preconceived biases.
And this learning curve, you say it's so incredibly steep, and the cost of that learning curve is a loss of life.
Well, that's the unfortunate reality of any pandemic, that is something new, and that's what makes it the pandemic, essentially. And we're fortunate in South Africa, as an example, insofar as much of the management of individuals with severe COVID-19, we're probably getting a better outcome than, as an example, in the UK or in Spain and Italy, because some interventions that we actually tried out there and subsequently shown to be effective, we can now implement those sort of interventions. So in a sense, we're somewhat better off than other countries that experienced a peak much earlier than we did, because we're gaining from their experience as well.
Yeah, absolutely. Professor, I was just reading up in preparation for our interview this morning, and one article saying that this is a virus like like humanity has never seen before. That's a pretty scary line.
I think it might be an overstatement. I think the Spanish flu, as an example, caused much more morbidity and mortality in terms of the percentage of the population. But certainly in terms of modern history, in terms of the century alone, this is a virus that we still simply haven't seen any like before. So it is, and it's causing much more severe disease. But the Spanish flu, the mortality rate of Spanish flu in 1918 was actually higher than with COVID-19, fortunately. But at the same time, in terms of the modern era, I think it is a pathogen that is pretty much quite devastating in terms of its impact, both in health, in terms of the economy, as well as in terms of the actual livelihoods of people.
Professor, just as a parting shot before we let you go, I think we're seeing a phenomenon that many professionals are talking about around South Africans, just people around the world, I suppose, only taking the necessary steps once they've been personally affected in their circle of friends and family by COVID-19. Just again, tell us the important steps that we need to take every day to protect ourselves and our families and those around us.
Yeah, I think the escalation that we're seeing in Gauteng right now, unfortunately, is nothing less than a behavior or the irresponsible behavior of the majority of citizens in this province, and unfortunately many other provinces. People simply are not taking this virus seriously, as you mentioned, until someone actually passes away in their family or ends up in hospital. For us to be able to actually change the clinical course and at least to bring about some level of control requires everyone in the population to adhere to these non-pharmaceutical interventions, maintaining physical distancing, wearing of face masks in public, avoiding overcrowded situations, and most recently, another important component now is making sure that when you are in any shared space, there's adequate ventilation to provide for dispersion of the virus very quickly so people don't end up inhaling contaminated droplets. But everyone has to do that. The fewer people that do that, the quicker the virus is able to spread, and unfortunately more people are going to die, and our healthcare systems are going to become overwhelmed much sooner, and in fact we're on the verge of collapsing right now, rather than just being overwhelmed in our healthcare systems.
Professor Mahdi, thanks very much for your time here on the AM Report. Some incredibly important advice there from Professor Shabir Mahdi, a vaccinologist at Wits University. Take the necessary steps for yourself, for your own family, and for the greater good of society as a whole.